Good afternoon. My name is Anna Carpenter. I'm a student at East Tennessee State University. My major is public health and my minor is global health and development. And today I will be presenting on the topic of universal health coverage within the United States. This is a highly debated topic within our nation, and most of that debate centers around the Affordable Care Act and Medicare for All. The United States has yet to pass any form of legislation that would provide universal health coverage to all Americans. Although the Affordable Care Act did provide health coverage to millions of Americans and is considered a critical step towards achieving universal health coverage, still 8% of Americans lack health coverage, and therefore health coverage is not universal. Now, before I provide my position on implementing universal health coverage within the United States, I would like to provide an overview of what exactly universal health coverage is. The World Health Organization defines universal health coverage as all people having access to the health services they need when and where they are needed. Health services are accessible without inflicting financial hardship on patients or their families. Progress towards universal health coverage within a nation is measured by two traits. First, the proportion of the population that has access to essential health services, and second, the proportion of the population that spends a large amount of their household income on healthcare. Now, looking at the United States and its progress towards universal health coverage, we look at measurements such as, according to the United States Census, 92% of people had access to health insurance in 2019. Leaving only 8% without health coverage. And the Kaiser Family Foundation found that the average non-elderly family spends 11% of their income on healthcare. Now, this percentage can vary drastically depending on a family's income level, insurance type, and health status. So some families may be spending much more than 11% of their income on healthcare expenditures. So with this, we can see that the United States still has quite a bit of work to do in order to achieve universal health coverage. What will it take to make universal health coverage a reality within our nation? Well, first, we must increase the capacity of our current healthcare system. So this will require increased health service resources, such as medical supplies, medical staff, and technology. Second, we must invest in public health interventions so that we are utilizing our healthcare service resources as efficiently as possible and preventing any disease or injury that can be prevented. And third, a mandatory funding source is needed so that we can distribute the financial cost of healthcare across the entire population and make it accessible to all Americans. And to achieve each of these will require policy. Therefore, policymakers' commitment is imperative to achieving universal health coverage. Now that I've provided an overview of universal health coverage and what that may look like within the United States, I will provide my position. United States policymakers should continue efforts towards achieving universal health coverage for all Americans, extending beyond those first steps achieved through the Affordable Care Act. There are two main justifications for my position of implementing universal health coverage within the United States. The first is that universal health coverage promotes population health, wellness, and longevity, and provides economic advancement opportunities and economic benefits. These benefits support the worthwhile value in striving to achieve universal health coverage. So looking into that first justification, that universal health coverage has the potential to promote population health. Both the World Health Organization and the United Nations have made universal health coverage a central imperative of their organization because they recognize its potential to promote population health. Currently, the United States is the only high-income nation that has not implemented universal health coverage. And the United States suffers an excessive prevalence of poor health outcomes, including the lowest life expectancy at birth, the highest infant mortality rate, and higher prevalence of chronic diseases than any other high-income nation. Health coverage impacts if, where, and when people receive care, and ultimately impacts their overall health. Universal health coverage also allows for effective coordinated public health response efforts. And we have seen this with the coronavirus pandemic. As in the United States, the majority of Americans receive health insurance through their employer. So with the lockdowns brought on by the pandemic, many lost employment and also lost health coverage when they needed it most. Now, the United States and other nations recognize the need for universal health coverage during this time. recognizing that the population would need access to testing, vaccination, and treatment in order to gain control over the pandemic. As the relationship with individual health and population health became very apparent in the face of infectious disease. Therefore, it was shown that universal health coverage would allow for more effective, coordinated public health response efforts. The second justification, universal health coverage provides valuable economic benefits. The United States currently spends more than $3 trillion annually on healthcare, and this is more than any other high income nation, yet we suffer some of the poorest health outcomes among our population. Population health is both an indicator and an instrument for economic development, as those facing chronic disease and disability often are not able to remain employed and aren't able to contribute economically to society. Universal health coverage is also a step towards equitable income distribution, as it allows for an even playing field for healthcare. Providing emergency care for the uninsured is also a huge economic burden for hospitals, and many have been forced to close because of this. And when hospitals close, that leaves the population they served with even more limited access to care. This instability allows for economic and health disparities to continue to grow. Now that I've provided an overview of the arguments for universal health coverage being implemented into the United States, I'll provide some of the arguments against implementing universal health coverage. The first is that initial increase in public health care expenditures that is required to transition to universal health coverage. This is a significant barrier, as many Americans are against increasing tax rates. Secondly, problems related to moral hazard, as when people gain health coverage, they are more likely to utilize healthcare services that may not be needed or more expensive services that aren't necessarily required. And lastly, upsurges in utilization that our healthcare system is not prepared for may occur as a result of universal coverage being provided, and this could potentially lessen the quality of care and lengthen wait times. Each of these is a significant barrier in implementing universal health coverage and will need to be addressed for sustainable policy and universal health coverage implementation. Considering the various arguments that I've provided both for and against universal health coverage, my position remains the same. The United States should continue progress towards implementing universal health coverage within our nation. And my recommendations to accomplish this goal are to first start with focusing on closing problematic gaps within the Affordable Care Act. The Affordable Care Act has already been passed into law and implemented within the United States health system, and beginning to address Affordable Care Act problem areas will provide more timely relief to millions more Americans who are still without health coverage. Obtaining universal health coverage may take extensive time, and Americans are in need of immediate assistance and support. Also, by taking time to review the Affordable Care Act and the extensive gaps within this policy, policymakers have the opportunity to learn from previous mistakes and can begin writing well-informed universal health coverage related policy. Implementing universal health coverage policy will require a bipartisan effort. Therefore, it is imperative that those already in support of universal health coverage work to gain the support of others. Medicare for All is a term coined for a single-payer government-run health program which would provide health coverage to all Americans and replace all existing public and private health insurance plans. The proposed universal health coverage policy has been consistently brought before Congress and debated for more than a decade. Many Democrats support some version of Medicare for All, but share different views regarding its implementation. In order to realize the goal of universal health coverage within the United States, policymakers must come together and engage in a conversation to work towards a bipartisan compromise that would provide universal health coverage to all Americans. Policymakers must work to understand the arguments both for and against universal health coverage and attempt to address and provide solutions to the concerns surrounding universal health coverage implementation. As these concerns are valid, adjustments to the current Medicare for All bill will be necessary to gain bipartisan support to get enough votes to get universal health coverage incorporated into law and enacted into our healthcare system. 2016 marked a monumental moment in history. For the first time ever, a slight majority of Americans said that they did support a national health plan. And with this historical moment, progress towards attaining universal health coverage is recognized. Through the necessary yet daunting steps of implementing universal health coverage, it is important that all those involved remember that healthcare reform is a process and sustainable change cannot occur overnight. That concludes my presentation. Here are my information citations, sources of my images used throughout the presentation, and thank you.